Good afternoon. Head Injury Jane here. I wanted to come on and talk about how my ears have been ringing. I want to say aggressively. um, and it's when they ring, right? There's popping in the sinuses inside. It's like these little pops or bursts. I need to go see the ear specialist. I really wanted this to all pass because I really don't like going to the doctors. I just don't. And but when maybe it's not necessary. Maybe right. Maybe this is just the ear ringing that's going to be, and the popping is part of it. Maybe I would be a candidate for, excuse me, a candidate for a CAT scan or an MRI or a PET. I'd actually like an MRI, looking for disrupted molecules. Finding out if there's, obviously if there's tissue damage, specific. And I'd actually like to have that done because ever since the head injury, I mean, when I went unconscious, I dealt with unconsciousness twice, and when I went down the second time, and it's in the very first video is pretty much, I think, me trying to explain what happened to me and what I experienced. But when I went out the second time, I saw what looked like black holes in both of my ears. It was really one of the most fascinating things I've ever seen in my entire life. I gotta tell you, it was like the universe was inside my head, and it was literally that vast. It was almost like I was one of those tiny molecules inside of my own head. And both of the ear canals or eardrums presented as like these black holes on both their respective sides, with this being the open, and then of course then the tighter, circular, part of the smallest, probably very, 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 very powerful part being the very inside of each perspective. It was amazing. It was literally beautiful. It was an inside of the black holes on both sides of what I was seeing it was like lined with stars. It was really magnificent. It was really magnificent. But I was terrified of dying and fought back both times from unconsciousness back to consciousness. But the second time, when I was seeing the stars, when I was seeing everything, it was so intoxicating. It was so intoxicating that I didn't want to come back out of. I did not want to come back out of that space in my head. But I knew it was almost like I was focusing on my chest, which is where I had a bag of ice. When I went down the second time, I had a bag of ice over my heart in a cold shower, and Anthony was holding my arm. I was clothed. But because I knew that the first time when I went unconscious, I was like, I fought back. As you well know, it's in the videos. But I fought back, and I asked for help to get into a cold shower, and I had this big bag of ice that was on my head where I hit it. And then I put that bag of ice over my heart and hit in cold water, and it was like this shock that went through me. It was so amazing. It would have to be like, getting the paddles, or it was just like this boom, and it was just it just straight through me. And then that's when I started going down again, and I was like, okay, you got to get me out of here. It was almost overwhelming. And that's when I did a controlled fall into the door behind me and just slid down. But the ears, what I saw when I went down that second time was inside the ears. And ever since the head injury, my sinuses, hold on, let me put my glasses back on. My sinuses in here pop. I can feel it in here and then into the head. It feels like it's popping. And it's audible to me. I can actually hear it. And it's not loud. It's not painful. Now, the ear ringing is when it's like it has been for the last, I want to say a couple weeks, I think. I know for the last week it's been hanging on me progressively hard. It's been sticking with me like it used to when it drives me crazy. And that's what I'm learning. Part of this is that's just normal now. For me to all of a sudden, my head just go bow and have no, there's no peace. I'm using white noise and I'm doing all these things. There's no peace from this kind of aggressive ear ringing. That's normal for me now. This is the new way of life. And it's disruptive. Because you can't think of anything. It becomes very difficult to think. And hey, buddy, the puppy. It's the puppy. It's blue. Oh, the baby. So, yeah, this is the new normal. So these things, as I was going through panic over the summer, and I kept coming through these things and experiencing these things, I kept thinking these things at the time when they originally started happening. Every time one of these things would happen, like for example, this aggressive ear ringing, I would think that something was being triggered and that I was going to die. And because I didn't know, I was like, oh, this is so bad, and this is so loud, and this is so, so aggressive. It's aggressive. Like as soon as I wake up, boom, it's the first thing. Now, when this is really bad, when this is really aggressive, this will actually wake me up. There's been many days where it's, I wake up because of the ear ringing. That's hard. So I'm not, right now it's at this steady, it kind of ebbs, it's ebbing and flowing as far as intensity. Of course, my ears never stop ringing, but this is both sides, and it's a bit of a higher pitch, and white noise doesn't help. I'm using two sources of white noise downstairs, and it's because it's in your head. You can use all the outside noise you want in the entire world. It does not matter, because this is right here, on both sides. Like this one, though, currently is ringing louder. So my left ear currently is ringing louder than the right. They're both ringing. And sometimes they'll just go, boo-wah, boo-wah. And I'm like, all these pitches of, like, what is like this, an orchestra is going off in my head, is I think how I've referred to it in the past. And I'd have to say that's kind of how it is. But it's kind of, this is now, apparently this is the new normal. And like I said, it's intensely disruptive at times. Now I can kind of, when I'm doing this, if I have to do stuff, I can do it, but I'm more intense because obviously I'm suffering, right? And then if I'm suffering, and that's going to cause a lot of distraction, and it is about, I guess, being mindful. That's one of the things that was pretty much the conclusion of me injuring myself. I'm going to try to be much more mindful, but this morning I already hit my elbow coming up the stairs on the banister that's been there. I'm like, how am I mean, but I only hit it on the outside, so I didn't hit it on the, I wanted to show you how beautifully this healed up. I want to show you how beautifully this healed up. It's only been a couple days, already looks great. Took some photos of it. I'm really good at treating wounds, and I went in there very aggressive because it was kind of deep, and I was like, look, I don't want to mess around with anything, right? I want to make sure it's taken care of appropriately. But yeah, the new normal is the ear ringing, the having these episodes, and apparently it's not life-threatening. I've already been through it a number of times, so it's not life-threatening. but it is extraordinarily disruptive, and it can be kind of scary because it feels aggressive and it affects your everyday life. I mean, if you're having aggressive ear ringing, it's really loud, and you're just trying to do anything else, it takes so much extra to focus, and as it is, you're already focusing extra because of the head injury. So it's like, you know, uh, just it's work. It's just work. The head injury now, it's like almost there are days where I have total relief. I mean, I say total relief. In other words, the ears are muted way down, and nothing is bothering me. But see, I've also had a headache for the last few days. I mean, I think I've had a headache now for 3 or 4 days straight. Just a subtle headache. And after after so much pain starts coming on, because my neck really does bother me. After so much pain comes on, I will take some ibuprofen, take a hot shower. I try to be as holistic as possible. So in other words, I have a high tolerance for pain. Because I'm just walking around with it in the ears and just the whole thing. So head injury Jane, experiencing what is a new normal. Just these bouts, and this is not even the extreme headiness. I just kept thinking, like I have said before, I kept thinking it was going to get better. Like, I was having an onset of something, right? When all of this really started scaring me. And it's also new for me. I kept thinking that, everything that I've been working on, and obviously the ear ringing is one of the, in the beginning that drove me crazy. Because I'm a silence girl anyway. I'm a reader and a writer. I like to research and write. So I like silence. I think silence is a good thing. And most of the time, I mean, I'm not the kind of person, I know I've talked about this, I've never had radios or music on, and even in an office I've worked in. I don't like that. So it is strange that now I have this constant it's a constant noise in my head at all times, constant. And so it's kind of crazy. Okay, well, I hope that you guys are doing good. I'm gonna go. I just want to come on and talk about that. And I literally was about to say I need to make an appointment with the eyes, ears, nose, throat specialist, but I had a CAT scan. I think they would have seen something in the sinuses if it were off. I think that this is the fallout. This is and it could go away. These things can improve. So that's, I guess, where it all kind of lands. Whatever it is that you're experiencing is whatever it is that you're experiencing, and it may improve or it may not. There are things that we can do, as we've talked about. I've talked about the neuroplasticity, reading, stretching the mind. Now I'm going to be practicing. I'm going to attempt to practice much more mindful movement. That's going to take some work because I've always been fast and but I need to slow down to protect myself. So now I'm going to practice I need to be practicing mindfulness and mindful movement to eliminate these injuries in an attempt to. Okay, take great care, watch your heads, and be safe.